Cleft lip is a birth defect in which baby's upper lip is not formed completely and has a gap in it. This may be on one side of the face or may involve both sides. A cleft lip may occur on its own or may be associated with cleft palate. Approximately 1 in 700 children are affected. What causes facial clefts? The exact cause is not known. However, it is associated with certain risk factors which include certain medicines during pregnancy, smoking during pregnancy, certain infections during pregnancy, changes in the genes or genetic mutations during pregnancy, mutated genes before pregnancy. How is facial cleft managed? A patient is referred to a fetal medicine consultant for further ultrasound scan to make sure that any other abnormality has not been missed. A patient is also referred to a neonatologist who will explain how the baby will be looked after when it is born. Does facial cleft affect how the baby is delivered? The aim is to deliver a baby vaginally. A facial cleft is not an indication of the cesarean section. What are the chances of facial cleft happening again? The recurrence risk in a child depend upon the severity of the cleft and the presence of the family history. The recurrence risk for the cleft palate on one side is about 2 to 3%. If it is lip and palate, the recurrence risk rises to about 4%. If the cleft and palate are both on both sides, then the risk of recurrence is 5 to 6%. If one parent is affected, the risk is about 4%. If both parents are affected or both siblings are affected, the recurrence risk is 10%. How to reduce the risk of recurrence? A patient is advised to take folic acid of 5 mg starting 1 month before trying for the pregnancy and continuing it until 12 weeks or after first 3 months. Folic acid reduces the risk of neural tube defects. Folic acid also reduces the risk of oral clefts by about 25%. How are cleft lip and palate diagnosed? Prenatal ultrasound can diagnose most of the clefts of the lips because of these clefts can cause the physical changes in fetus's face. After birth of the baby, the physical examination of the mouth, nose, and palate can diagnose the cleft lip or cleft palate. Amniocentesis is a specific test in which amniotic fluid is removed and that is tested for the chromosomal analysis. What is the treatment of cleft lip and cleft palate? Surgery treats cleft lip and cleft palate. The exact details of the treatment depend upon the extent of the clefts. And this chart explains the approach to the cleft patient. Prenatally, the genetic diagnosis is done. From birth to 3 months, lip tapping and NAM is done. In 3 to 4 months' time, lip adhesion and lip repair is done. In 1 year time, the palate repair is done. At 2.5 years, the speech therapy is done. Orthodontic treatment is done at the age of 6 to 9 years. Orthognathic surgery is done at the age of 16 to 18 years. Cleft lip and palate is one of the fetal anomalies. Here we have a list of other fetal anomalies which include anencephaly, the hydrocephalus, spina bifida, encephalocele, cardiac anomalies, renal anomalies, GIT anomalies, torch infections, twin pregnancy, abnormal knuckle translocancy which is the Down syndrome, epilepsy associated abnormalities, diabetes associated abnormalities, the different drugs, cystic hygroma, omphalocele, gastroschisis, exomphalos, congenital diaphragmatic hernia, meningomyelocele, duodenal hernia, choroid plexus cyst, echogenic bowel, hollow proson cavity, ventriculomegaly, congenital pulmonary airway malformation, cleft lip and cleft palate, fetal hydrops, duodenal atrasium, Cary malformation, and Porter syndrome. This is the ultrasound showing hollow proson cavity. Here we can see the hydrocephalus as compared to the normal one. Here you can see the spina bifida, the encephalocele, fetal cardiac anomalies, fetal renal anomalies, fetal GIT anomalies. And here we have the Porter syndrome, in which there are bilateral renal agenesis or bilateral multicystic dysplastic kidney, resulting in reduced urine excretion and oligohydramnios, causing fetal compression. Along with the Porter facies, the pulmonary hypoplasia is another characteristic feature of the Porter syndrome, and we have also the limb deformities in this type of syndrome. So thank you so much. That was all about the cleft lip and cleft palate, along with certain other fetal anomalies. Subscribe on Obs and Gynae. Thank you so much. Allah Hafiz.